Okay, so for urinary catheter, you want to introduce yourself to your patient. You also want to confirm in two different ways of who the patient is, so by name and birth date. Before you start, you want to verify the orders to make sure there is no allergies or if there's specific equipment that you're supposed to be using. Assess their peri area for any redness or open sores or anything like that. Cleanse if you need to. And you want to gather all your supplies before you start. So you want to provide privacy and have your supplies by your bedside. You want to wash your hands and explain the process to the client. So this is Edna. Edna, we are going to put in a catheter today. I will explain every step that we do. So I'm going to provide a bath blanket here for you. And I'm going to take down your blankets. Okay, Edna. I'm going to bring the blanket up. And if you can, bring up your knees into the side. Okay. Now we're going to open the kit. Okay, we're going to drape over. And now we will don sterile gloves. Okay, and next we will open the iodine. set up the bag, and the bag is already attached. And the Foley itself is still sterile. Okay, and then you'll need the lube. Okay, and then we'll apply the saline syringe to the catheter, so it's all prepared when we insert. Okay, now we'll take this off. Woo-woo. Okay, Edna. All right. I'm gonna clean you with the iodine. Once down the middle, discard. Once down the side, discard. And once down the other side, and discard. And once the iodine is there, make sure we got the lube. And okay, Edna, I'm gonna spread the labia, and I have the catheter. Take a deep breath, and you'll push it in until you don't feel any resistance, which is probably about a few inches. And then you'll inflate the balloon. Okay. And it's inserted. And you'll tug a little bit to make sure that it's in. And then you'll clean up and discard. To remove the catheter, you'll take a syringe and you'll apply it to the catheter. And you'll take out the liquid that's in the bubble and gently pull out the catheter. When you remove the catheter, you always want to empty the bag also and keep track of urine that is coming out. It is important to make sure that they're hydrated. And you'll clean up, don off the gloves, and wash your hands. And for males, it's very similar, but for males you have to straighten out the penis, and if they have foreskin, pull back the foreskin in order to get the catheter in. You will have resistance with males. You have to push a little farther in due to their urethra being longer. If they have an enlarged prostate, you'll use a Coude catheter, just because it's harder to get a regular one in. For males, you definitely want them to breathe in and breathe out before putting it in and taking it out. It's a little bit more uncomfortable for males than it is for females. So you'll get it all cleaned up and cover the resident back up, lower the bed, and make sure they have their call light.